Good evening everyone, how are you? Hope you are doing good. Today I am going to talk about one of the important antifungal agent, that is posaconazole. Let's go into the topic. Posaconazole is a synthetic structural analog of itraconazole with the same broad antifungal spectrum but with up to 4-fold greater activity in vitro against yeast filamentous fungi, including some but not all. It is also active against mucormycosis. It also has activity against yeast in vitro, which is similar to voriconazole. The mechanism of action is the same like other imidazoles, that is inhibition of steroid 14-alpha demethylase. Posaconazole is available as a delayed release tablet intravenous formulation and a flavored suspension. The delayed release tablet and intravenous formulation, they provide a more consistent viability in the presence of concomitant disease states, medications, and dietary considerations that alter the concentrations achievable with the oral suspension. The viability of the oral suspension is significantly enhanced by the concomitant presence of food. The drug has a long T-half, large volume of distribution, and extensive protein binding. Steady state concentration are reached in 7 to 10 days when dosed 4 times daily. Renal impairment does not alter the plasma concentration. Hepatic impairment causes a modest increase in the plasma concentration. Almost 80% of the drug is excreted in the stool, with 66% as unchanged drug. The major metabolic pathway is the hepatic UDP glucuronidation. Hemodialysis does not remove the drug from the circulation. Gastric acid improves the absorption. Drugs that reduce the gastric acid like cimetidine, esomeprazole, decrease the posaconazole exposure by 30 to 50%. Diarrhea reduces the average plasma concentration by 37%. Posaconazole is approved for the treatment of oropharyngeal candidiasis, although fluconazole is a preferred drug because of its safety and cost. Posaconazole is also approved for prophylaxis against candidiasis and aspergillosis in patients more than 30 years of age who have prolonged neutropenia or severe graft versus host disease. It is approved in the Europe as salvage therapy for aspergillosis and several other infections as are itraconazole and voriconazole. A recent comparison trial of posaconazole and voriconazole supports the use of posaconazole as a first-line treatment for invasive aspergillus. Posaconazole has increased activity against the molds that cause mucormycosis and is frequently used as an alternative to amphotericin B for intolerant patients. For prophylaxis of invasive aspergillosis and candidiasis infections, the adult intravenous dose is 300 mg twice on day 1 and 300 mg daily thereafter. And duration of therapy is based on recovery from the neutropenia or immunosuppression. The same dose is used for the delayed release tablets also, but the dose for oral suspension is 200 mg 3 times daily. Common adverse effects of this drug is nausea, vomiting, diarrhea, abdominal pain, and headache. Although adverse effects occur in at least a third of the patient, the rate of discontinuation due to adverse effects in long-term studies has been only 8%, so it is a safe drug. Posaconazole inhibits the CYP3A4 enzyme. Posaconazole can also prolong the QT interval. Thank you. It is my 50th YouTube video. Thank you so much for your support, and kindly share my lecture to your friends.